Yeah, Wayne, do you know much about hands?
Oh,
Okay. Sophie brought me a jar to open about 2.5 months ago.
still can't open it.
Still can't open the darn thing. We know you get a butter knife or something to pop the seal. Well, I was sitting on the porch, wasn't the brightest move, but I go, I'll smack the lid with my hand and let my ring hit the edge of it.
This
And-
feels sharp to you.
Just a little, not too bad.
Okay.
Not too bad. Well, I tried to let my ring hit the edge of the jar there, and it did. But in turn, the jar hit right here on my hand,
Mm-hmm.
and it
You're
hurt.
gonna feel a pinch.
Okay.
Keep talking. I'm listening.
And so anyway, felt pain pretty instantly. And commenced to reach down and feel my hand, and felt like almost a ball there, almost like the size of a bearing, a small bearing.
Yeah.
And when I do my ring finger up and down, you could feel like this ball bearing thing moving back and forth. So I'm like, oh boy, I either broke a bone or I knocked something out of place there. Like a
You probably
ligament or a cartilage or something.
you probably developed a little cyst on the flexor tendon. It's common right there. Does your finger trigger at all? Like get stuck or anything when you flex and extend it?
No, hasn't done anything like that. Just, if, I work on the floor, so if I go to push myself off the floor right there, I feel it's a little more sensitive. And so I've just been kind of hoping it goes back in. Well, Sophie, she was going to a physical therapist for her back, and she asked him about it, and he says, well, tell him to take a couple shots.
In the book.
And yeah, massage it a little bit first, and then give it a real hard impact and see if you could push it back in.
That sounds good, but a person never has enough nerve to hit it that hard.
I know, so I haven't tried.
You all right?
Yeah, I think I'm okay.
You'll feel some pressure.
Just feels a little pinchy. So anyway, I went for a ride last Sunday with my nephew and his buddies.
Mm-hmm.
Well, we're going up by Deer Valley. And I'm a little gun shy. I got in a head on there a couple years ago. Anyway, I'm take it slow, and we got up close to the top. And come around a corner. Sure enough, here's two bikes. Oh shit. Well, the one guy, he got over to the left, which is what you're supposed to do. Get over to the far as you can.
Right.
Made it around him. The second guy wasn't as cordial. He kind of hogged the trail. So I got over to the far right as far as I could.
You all right?
And yeah, I'm all right. And when I did, I hit the loose dirt on the edge of the berm there, and then the bank goes straight down. Well, the bike kind of washed out. I was probably going 5 miles an hour at that point, no big deal. The bike kind of washed out. I went down. I landed on my hands.
Mm-hmm. That probably didn't help that thing, and he did it.
The ironic... Ooh, that felt a little weird.
Sorry.
It's all right. The ironic part was, I think it popped it back in.
Oh.
Yeah. I think I landed on it so perfectly that it popped that sucker back in.
You think you'd be that lucky, huh?
I think so. I think a small miracle took place.
More likely what happened is it's a little cyst and you burst it.
Oh, really?
Uh-huh.
Okay. Is that not a bad outcome, or?
Uh-uh.
Kind of makes sense because it was sore.
Well, yeah, and it felt like I said, like a little ball bearing on the end of a ligament or something.
Yep, I know what you're talking about. I can figure it out for you.
And I can still feel it a little in there, but it feels like it's deeper in there, like maybe where it should be, rather than all the way out to the skin level.
You're going to feel some vibration now
Okay.
because I'm messing around with the screw and I'm clearing the stuff off of the head of it, and
Okay.
you'll feel that all the way into your bone.
Okay. No, I'm good, honey. I'm just trying to stay as relaxed as possible here. It's not.
You're doing good.
So far, not too bad. I think the needle was the worst so far.
Yeah, that usually is. And I'm just making some room around the screw head here.
I wore my good luck shirt. It says hang loose.
Is that your good luck shirt?
It's my hang loose shirt anyway. But no, other than that, it was a great ride. Other than running into those two guys,
Yeah, right.
kind of a redemption ride from the last time.
A redemption ride?
Well, yeah, the last time I went up there, I got in a head-on with this guy, and it was a pretty hard head-on. Luckily, nobody got hurt.
Where was this that you went?
We started at CC Camp at the base, the back of Upper Lake there.
Yeah.
And then went up Sled Ridge toward Deer Valley Campground, which is on the very top of Elk Mountain.
How long a ride is that?
It's about, mileage-wise, it's about 11 miles. So, on a bike or a quad, it'd take you a good 30 minutes.
Uh-huh.
But real pretty ride. Just some of the trails are so tight, you just hope nobody's coming the other way,
Yeah.
That's the part I don't like. We went Super Bowl Sunday and thinking, okay, should be less traffic up there, and we were right. Those two bikes were the only guys we ran into the whole time, other than the forestry we ran into up there.
I'm going to lean on your thigh a little bit for some leverage here.
Sure. So do those screws, do they kind of get embedded in there, Dr. Shadowman?
Well, the tissue sort of wants to grow over the heads, you know.
Over the head more.
Yeah.
More
So,
than the stem of it, or
yeah,
whatever?
the stem of it really doesn't get stuck on anything. It comes out easy, but the actual head of the screw,
I see.
gets stuff over the top.
Uh-huh.
So I'm using a little hemostat to feel the head, to clear everything out around it, and to feel myself go into the head. And then I sort of remember where that is when I put the screwdriver in it.
Okay. Yeah, I wanted to do this back in December, and my little brother was going to come up. He's in the Marine Corps and stay with me for a week.
Mm-hmm.
So I decided not to, just, you know, due to the fact he was going to be there for a week, and wasn't sure how easy I might have to take it.
Am I hurting you?
No.
Kinda.
Felt a little pinch, like probably at the very tip of the screw head. But I'm okay.
Is it painful?
It's just a shocking. Ah! Fuck.
Don't like it?
Just a shocky pain where your fingers are. Ah!
You okay?
Oh, God. Oh.
Now, I'll tell you what happens
It's
here, okay?
It's okay. It's okay.
Okay, it's coming out, and
Yeah, it's
it'll
coming
hurt
out.
less and less, okay?
Oh, shit.
Yeah, it's coming out. You're almost there, honey.
I can see it if that helps you.
Ah.
Okay, now, right now, the threads are going to pass through part of the bone, okay? So I'll go slow,
Sure.
but it will feel weird. And if it helps you, you can take all the money you're saving by not going to the hospital.
Oh, God.
You all right?
It's okay.
The painful part's almost done.
Yeah.
You okay?
Shit.
It's almost out.
My whole leg's got shocking.
Yeah, that's the one thing I can't anesthetize is the reflection of the pain down the bone.
Oh, God.
Take a squeeze. It's okay. It's okay.
So what I'm going to do is this. I'm going to take a turn on it, and then we're going to rest. Okay?
Yeah, we're okay now. Seems okay.
It's that first part.
That initial release, huh?
Yeah.
Oh, man, it felt like lightning in there.
Oh my
bet.
God, yeah.
Oh, boy.
Whoa.
Get it out?
Almost. Holy.
There's one earring. Okay. Now, you got to wash your
There's
okay?
one earring, he says.
I just got to retrieve the earring.
Oh, shit.
Oh my gosh.
You all right?
I'm okay.
Okay. One's down.
One's down, okay.
It's out. The washer's out.
Sweet. Sweet.
How do you turn this off for a brief moment?
Just leave it on.
Oh my gosh. Don't answer that.
Oh, boy.
It's right there.
Fun, huh?
Fun.
Okay. One's down. Cool.
Ooh, doggy.
It's right here if you want to look at it.
No, I'm cool. I'll look at it here in a few, honey. plenty of time to see it.
Yes, you will. Okay, so what I'm going to do is use this opportunity while you catch your breath to put a little more Novocaine in the other incisional area.
Okay. Wayne, do you got like a real short footstool by chance? Maybe I could just put my right foot on.
I do.
All right, awesome.
All right, just raise that one up and we'll put it right.
Oh, perfect.
Is that better?
Yeah, it took some tension off my lower back there.
Yeah, okay, yeah, probably. Okay, now, this other one's pretty numbed up, so I don't think you're going to feel this Novocaine I'm putting in here. You may feel a little something, but... You're a tough guy.
Yes.
Oh man, that didn't make me feel so tough.
Well,
But I imagine anybody would have felt that.
pretty much any human being that was breathing would. Okay, so let's see. That's at a bit of an angle, the one that's posterior, so we're going to do this, okay. Pinch. You okay?
Yeah. Is there nerves inside the bone, Wayne, or no?
No, the bone itself doesn't, but the covering does, and that's why you have that discomfort as the screw passes through that. I try to anesthetize it the best I can, but it's imperfect, I gotta say.
Sure.
You still fairly comfortable?
Yeah.
Okay, good. Think of the guys in the Civil War, no anesthesia at all,
Oh man.
just a lot of liquor. And
A
we're gonna-
lot of liquor.
We're going to cut your leg off. We'll do it fast, though.
Biting on a stick. Here, bite this.
And you might bleed out.
Yeah, that's right.
And they get a hot iron to cauterize it after that.
Yeah.
Yeah, that's hardcore, man. We get it pretty easy nowadays, I guess.
Yeah, in a lot of ways, but, you know, don't really have anything to compare to, so it's still pretty nasty for you.
Yeah. What percentage of people get their screws removed, Wayne? I mean, is it due to or in relation to where they're at, and
Yeah, it's really related to how.
and if they even should come out? I suppose there's some cases where you don't even want to take them out.
There's some cases where it's pretty complicated to take them out, and if you can avoid that, that's great. Generally, nothing has to stay in because screws are a temporary thing, and they hold the bone until it's healed. And
Now-
after the bone's healed, really, you don't not an issue anymore.
Okay.
You're going to feel some vibration again because I'm on the screw.
Okay. No power drill today, huh?
Man, if I hit that power and that thing came out fast, I'd have to take you off the ceiling. Really. So I'm just kind of going through what I went through with the other one, which is to make myself a path to get the screwdriver into the head.
Okay.
And that's why you feel the digging sensation.
Okay.
That's essentially what I'm doing. You're blessed with fairly good muscles over the area, so that's trying to be nice to them, but at the same time get what I need.
Yeah. Yeah, I haven't really focused on rehabbing the left leg too much. I mean, as far as isolating exercises specifically, for it.
Yeah, generally, a guy your age and as active as you, it just gets rehabbed just because of the way you are.
Yeah, I could tell it's getting stronger. take another x-ray at all, Wayne, to look at anything, or not necessary, or?
Not necessary. Would you do me a favor?
Lock the door? Or
No, actually, would you, somebody just came in. Would you just tell them that I'm doing a procedure, and if they would like to come back in about an hour, it'd be great.
Okay.
And I'm sorry for the inconvenience.
Okay.
Her name's Tara. Alright, let's see if I can get this thing in there. Thanks, Tara. I'll be here for a long time.
Okay.
Not with you. Sorry.
Hopefully it won't be as bad with the second one.
That's good hoping.
Yeah.
That's a good way to hope.
That's a good way to hope there, girl. You just keep hoping.
We're all in agreement there.
Alright, I'm getting close, just so you know where I am here.
Okay.
I'm going to be kind of rough for a second. And that was a little higher.
See if you're squeezing me. You gonna be okay there, honey?
I don't know.
She's doing fine.
I hope I don't pass out.
Yeah, and hit your head. I can dial 911 at the best of them. I'll tell you that. Mhm. Gonna feel some pressure. She's looking away, but she's filming. I don't blame you. Just got a lot of gristle right here, and I'm just trying to clear it because I'm doing this through a pretty small little hole.
Okay.
You're nice to hold his hand like that, I gotta say.
Well, of course.
Well, not everybody would do that. You okay?
Yeah.
Am I getting your attention a little bit?
Oh, just a little.
Alright. Okay, so that one's... And that's headed. Okay.
Yeah, fine. Totally fine. So you go through the same scar?
Uh-huh. Would you like to go do my thing again? There's someone out there.
Oh, is there?
Don't know who it is this time. Just to ask who it is.
Okay.
The second one being a pain in the ass?
I'm trying to be nice to you.
I appreciate that.
Nobody came in. It was like a black
Oh.
SUV.
Oh, that's the dentist next door.
Oh, okay, yeah.